This video will review postoperative instructions after partial knee replacement. On the day of surgery, when you transition home, your coach or support person will drive you home and be with you overnight. You can be up walking with assistance, going to the bathroom, and doing stairs as instructed by the therapist. You should be safe, take it easy, and pace yourself. Stay well hydrated, and be careful to change positions from lying to sitting to standing slowly. Start the pain management as instructed by the discharge nurse, and take the oral antibiotic and start the TXA medication tonight. On postoperative day number 1, your dressing will remain in place and there's no wound care that needs to be done. You should pace yourself, stay well hydrated and nourished. You will be seen today by a home therapist who will help assure that you acquire excellent range of motion, strength, and function. You should continue with your schedule of medications and start the aspirin today. Most patients will take 325 milligrams twice daily, but in some patients with a history of GI problems or kidney problems, we may suggest just taking 81 milligrams once or twice daily, and this will be reviewed as part of your pain management schedule. You should also start a constipation regimen, which often includes Colace, 100 milligrams twice daily, and Miralax, 1 tablespoon mixed with water once or twice daily. On postoperative day number 2, the ACE bandage can be removed, and there is a dressing over the incision that should remain in place for about 7 days. You may shower today, keeping the dressing in place, and just try not to have the water hit it directly. Continue with the home exercise program, pain management, and swelling control. And if you find that your legs are swelling, which is not uncommon, elevate them above your heart with pillows, and we'll review this shortly. Postoperative day 3 through 7 and beyond, you should continue with the medication regimen, and you can taper off some of the stronger pain medications as you don't require them anymore. You can see our video on pain management for further instructions on this, which is also included at the end of these modules. You should continue the aspirin therapy for 30 days, which is to prevent blood clots. Continue the home exercise program and swelling control. Continue with good hydration and nutrition, and try to resume as normal a sleep cycle as possible, napping when you feel tired. As far as pain management, your care team will provide a schedule for medications to take after surgery. And again, we have a comprehensive module specifically on this, which you can review as part of this patient education series. This takes into account any allergies, medication intolerances, or potential medication interactions that you may have. So it's tailored for each patient. Staying ahead of the pain is paramount to achieving your rehabilitation goals. And that's what this multimodal program is designed to do, which is why many of these medications are designed to be taken on a fixed schedule. We will arrange a visiting nurse and therapist for the first 1 to 2 weeks after surgery. This person will check your vital signs, assess your surgical site, and instruct you on activities and exercises to do. And they'll also work on your home exercise program and swelling control. And this provider can communicate any concerns to your care team. As far as wound management is concerned, your incision is closed with absorbable stitches and skin glue. Again, there will be a dressing over the incision and an ACE bandage for compression for the first 2 days. As mentioned, keep the bandage in place for 7 days, and after that it can be open to the air. Try to keep the area clean. Swelling control is very important. Swelling in the knee can act like a glue after any kind of replacement surgery, causing increased pain and stiffness. Active swelling control is important immediately after surgery and on a regular schedule. Ice and elevation, which means getting your toes above the nose, are the best methods of swelling control. Elevation should be performed for 30 minutes at a time. Icing is also important for swelling control and should be applied to the knee 20 to 30 minutes at a time, several times daily. You should place a cloth or clothing between the ice and skin to avoid any kind of frostbite or frost burn. We recommend making ice bags with a 1-gallon Ziploc freezer bag, 1 cup of rubbing or isopropyl alcohol, and 3 cups of water. The alcohol prevents the water from freezing and it makes it a slushy gel. And if you make 3 or 4 bags, they can be exchanged when one of them thaws out. Elevation requires that you get your knees above your heart so that water can flow downhill away from your knee back to the center. Elevating both of your legs is important because both legs can swell after surgery. And you can use several large pillows and set this up in advance in a place that's easy to get to. Spend 30 minutes 2 to 3 times daily for the first 2 weeks elevating your legs. Daily exercise is critical after partial knee replacement to gain maximal range of motion. This does not happen automatically, but takes motivation and grit. Frequent stretching exercises in both flexion and extension are key to try to achieve a functional range of motion. Our goal is for patients to achieve a motion range from 0 to 130 plus degrees. It may take up to 3 months to get this full range of motion, but the earlier patients achieve it, the better, as scar tissue begins to set in with time, making it more difficult the further out you are from surgery. Outpatient therapy usually starts a week or 2 after surgery. Depending on which knee you had replaced and how your recovery is proceeding, you should expect to arrange transportation for the first few weeks. Consult with your care team about where you plan to attend outpatient therapy, as our office does recommend certain practices who are most familiar with our protocols and goals. Most patients will attend outpatient PT for 8 to 12 weeks after surgery to maximize range of motion and strength. Maintenance exercises are also very important to the outcome. Since you will only be attending outpatient therapy for 2 to 3 days per week, it is essential that you perform daily exercises on the other days. Full recovery from partial knee replacement can take up to a year as the healing process matures and patients continue to make gains in motion and strength. We highly recommend that all of our patients continue a maintenance home exercise program that continues beyond the end of formal physical therapy. Typically, we see patients in follow-up at 3 weeks, 3 months, and 1 year after surgery. At 3 weeks, if patients are not achieving sufficient range of motion, we will see them back at 6 weeks to determine if a manipulation under anesthesia is indicated. This is very rare after partial knee replacement. If you have any wound problems, such as redness, increased swelling, or drainage, we may request that you come in for a wound check earlier. It is important to allow sufficient healing before returning to strenuous activity. In general, you should wait 8 to 12 weeks before engaging in strenuous exercise to avoid injury to the soft tissues around the new partial knee. The early focus should be on maximizing range of motion, while strengthening should be a controlled and gradual progression. Walking and biking are good early low-stress exercises. Hiking, skiing, racket sports, or anything that requires significant joint loading, impact, or agility all require that patients are well healed and rehabilitated. Check with your care team about return to such activities.